The person who is allergic has made antibodies to fight off something like pollen, mould, dog, cat, or maybe a food, and when they're in contact with that substance, the trigger substance, the allergen, reacts with the antibodies they've made, and that causes cells known as mast cells to burst and release histamine into the tissues, and it's histamine that produces symptoms such as itching, rash, and fluid leakage. By putting a small amount of the test substance onto the skin and pricking it into the skin with a lancet, we can see if the patient has an antibody response in that area of skin. If they do, they'll react to the allergen we've placed on the skin with a little red itchy wheal that comes up in about 10 or 15 minutes. Skin prick testing can be done to a whole range of different allergens. Mostly it's used for allergy to aeroallergens like house dust mite, pollens and pets, but you can also do skin prick tests for foods and things like latex. Skin prick testing is generally very safe, but we don't do skin prick testing on everybody. People on certain medications such as antihistamines can't have skin prick testing done because it will interfere with the result of the test, and there are one or two other medicines that can interfere with the test result in the same way. Patients who've had very severe reactions shouldn't be skin prick tested except in a specialist allergy centre where there are special facilities available just in case they have a bad reaction. And people with severe asthma may not be skin prick tested for the same reason. But the vast majority of people with allergies can undergo a skin prick test very safely, and skin prick tests are widely used both in primary care, in community allergy testing, and in hospital allergy testing settings. So Paula, we're going to do a skin prick test to try and confirm a diagnosis of allergy for the things that we think you might be allergic to.
I think it might be cats, dogs, horses, rabbits, anything furry. My eyes swell, I get blisters on my eyes run, I get a running nose, my chest feels tight, I get rashes.
And do you get any symptoms when you're not around animals, for example? Do you get hay fever in the spring or the summer at all, or do you get any symptoms in the winter?
No, never, only when I'm around animals.
Okay. So Paula, we'll go ahead and do a skin prick test and see whether you're allergic to cats and dogs. We'll also check for house dust mites and pollens out of interest.
Okay.
And just see whether there's any sign of anything happening with them. So what I'm going to do is blob some of these different extracts onto your skin, just a little drop on your skin, and then prick through them with a little lancet which has got a tiny point on it. It's not like a needle, you'll hardly feel anything, just a bit of pressure. And any of these that are positive will come up as a little red itchy lump over about the next 10 to 15 minutes. Apart from that, you shouldn't really feel any other symptoms at all. Normally it's just a bit of itching on the arm. Is that okay?
That's fine, thank you.
So I'm just going to write on what we're going to do first on your skin. We'll also do a positive and negative control so that we know that the test is working properly.
Okay.
So we'll do cat, dog, 2 house dust mites and pollen. And then we'll do a positive control and a negative control. What we do is just blob this onto the skin. So the positive control is histamine, that's to make sure the test works properly, and the negative control is just saline, and that's to make sure that just by pricking a needle into your skin it doesn't come up with a little itchy lump. That's cat, and then dog, and these are the 2 main house dust mites. And then grass pollen. So we're now going to prick each of these into the surface of the skin with a little lancet. You might start to feel something itching in a few minutes.
Okay.
Okay, now we'll just blot these off.
Thank you.
Now we need to wait 10 or 15 minutes and see what happens.
Righto.
Okay, Paula, so we've had 15 minutes and now we can have a look at the test results.
Okay.
And as you can see, they've come up quite nicely. The positive control has come up positive, which it should do. That shows the test is working okay. And the negative control is negative, as it should be. And that shows that just pricking your skin with a lancet hasn't produced a positive result. And cat, dog are positive, as we expected they would be, because you get symptoms when you're in contact with those animals. House dust mite has also come up positive, even though you don't get symptoms from that at the moment. And that's the important thing about skin prick testing. We need to look at the results in the context of the patient's history, because this could lead us to believe that you're allergic to house dust mites and grass pollen, but we know that you don't have any symptoms in the summer and you don't have any symptoms in the winter when you're in contact with house dust mite. So although you're sensitised to these things, they're not actually causing you any problem at the moment. So what we need to do now is just measure these. So the positive control is about 3 millimeters, and we compare the others with the positive control. So the cat's about 3, and the dog 4. House dust mite is 4, and the other house dust mite's 3. And the same with the grass pollen. Okay, so the itching will settle down over the next 10 or 20 minutes, and then these wheals will gradually disappear in the next hour or two. So we don't need to do anything else about this at the moment. And what we can do now is give you some advice about how to reduce exposure to the cat and dog allergens so that you don't get so many symptoms when you're in contact with the animals.
Okay.
And also give you some advice about what medication you can use to control your symptoms.
Okay, thank you.